Hi, everybody. Welcome and thank you for coming. I want to introduce you to our speaker today. It's Dr. Navneerat Nibber, ND, who is a graduate of the Canadian College of Naturopathic Medicine and a registered naturopathic doctor, as well as recipient of the 2015 Naturopathic Honor Award. Currently, she runs a women's health collective in Surrey, BC. In addition to her clinical and consulting work, Dr. Nibber is a medical advisor and brand educator for advanced orthomolecular research, engaging with international research in the naturopathic field, and is also a published health expert in over 25 international publications. Welcome, Nirat, and thank you for doing this for us today.
Yeah, thank you so much, Jen, and welcome everyone. I really appreciate the opportunity to talk to you today about something I think that we see a lot in clinical practice. So I'm so glad to have you all here. Just some housekeeping notes. This is very much for educational purposes, and we're not really laying out very intensive treatment plans, but I'm always happy to speak with anyone more if they are requesting certain insights. This is obviously being put on by AOR, so thank you so much for that opportunity. As Dr. Marion kind of mentioned, I am a naturopathic doctor and I practice out in Surrey, BC, and our focus of our clinic is very much for women's health. And part of that you see more and more is this rise in incidence in autoimmune conditions, and mitigating that always seems to come down to these simple strategies that feel like we can overcomplicate it fairly easily and quickly. So I want to, I was really excited to take this opportunity today to guide you through kind of how I've approached the inflammation component, because autoimmune is a huge realm and umbrella, but understanding how the inflammation component really is ultimately that sword, and the autoimmune condition itself wields that sword to different tissues, and how the pathogenesis and progression of certain conditions is influenced by inflammation, and how we as practitioners can start guiding that or mitigating some of that, is a powerful tool. And certainly something, as you go through your naturopathic education and into clinical practice, that I anticipate most of us will be encountering more and more of. So I think from the simplest perspective, when we look at inflammation, there is this component that it is a double-edged sword. There is a necessity to it in an acute form, and it is meant to mitigate infection or injury. It is a proactive response whereby you're quenching or eliminating a threat in an aggressive way. What happens when you overcorrect and keep doing that, and you keep acting as though the threat is there, is you transition from an acute to a chronic or long-term low-grade inflammation. Now, that is really what we're emphasizing when we're talking about the development to all these larger disorders or larger concerns, is this chronic low-grade inflammation, because that's often what gets overlooked and undertreated. So I enjoyed this infographic because I find that it helps guide and understand why some people have a propensity towards going to that chronic and low-grade inflammatory pathway, and why some people are able to quench and turn on and off their inflammation faucet a lot more effectively. And this is a function of, our genetic predispositions. The lifestyle and stress components should not be underpinned. But certainly looking at those pro-inflammatory cytokines and factors, and how they then manifest and get redirected into these leaves, which are, of course, these larger disorders. Now, what's interesting is inflammation is this key component of many of these chronic disorders, but the pathogenesis of these disorders then also propagates and increases inflammation itself. So it is one of those self-fulfilling, continuous hamster wheel cycles that once you get on, it can feel really overwhelming to try to get off. And of course, we know that there is, oh, my, and my computer's frozen. Sorry about that. Are you guys able to see my slides? There you go. Okay. So we know that that transitions to one of the most important aspects that we as naturopathic doctors tend to focus on, which is that first barrier of entry, so our mucosal lining and particularly our gut. So gut intestinal permeability and that inflammatory connection is where a lot of things can start to go awry. We start to see that changes in gut microbiota, food allergens, the increase in gut permeability can increase your metabolic endotoxinemia. So now suddenly your system is inundated with all these potential threats, and the response is the appropriate one, which is inflammation. But all those checkpoints that we normally have to rein inflammation in are suddenly overridden because there is this constant influx. Now we know that with inflammation, there is, or with immune function in general, there is a timed response. So we have our innate immune system, which is a non-specific response and has this immediate and maximal response. And that acute inflammation is really mediated by the innate immune system. And then, of course, we transition to this adaptive immune system whereby we start to develop memory, immunological memory, and you're taking actual cell-mediated humoral components to help lead and guide that. And within this, particularly in development, we begin to develop the differentiation between self and non-self, and that process is particularly important, and we'll get into some of those treatment approaches for that, but that development of self and non-self and those mechanisms are incredibly important. And what we're seeing, particularly with autoimmune conditions, is that there is an overriding, there is a inability to differentiate the self-protective mechanisms. And again, I mentioned at the top that this tends to be more common in women, and there are certain reasons for that in terms of exposure to different viruses, the hormonal components of protection, and then in different stages, the balance between those innate responses may fluctuate, particularly in pregnancy. So what we're seeing with autoimmune conditions, things like rheumatoid arthritis, ankylosing spondylitis, SLE, Sjogren's syndrome, there is this inability to understand that the stop mechanisms in place are there for a reason, and they are now, everything is sort of seen as threat. So there is this hyperactivity. Now, we know that the malfunction of certain T and B cells is involved, which we'll get into in a second, but oftentimes what's really fascinating is there is this infection that tends to precede the hyperactivity or the overreaction. So it's the trigger, if you will, that shifts everything. So when we're looking at autoimmune disease, there are a number of infections that are being associated with the onset or disease severity. One of the most notable, I think, that we've seen in the last little while has been with MS. And I think some exciting new research has come out that does have that direct link with EBV infection, while I think a lot of NDs and functional health practitioners have been ringing that bell for a long time of how important it is to mitigate infection early on. And while we think maybe we've cleared an infection, we really need to investigate whether it lingers and those systemic impacts. This is an exact, I think, description and highlights that importance of how it doesn't just go away. These have long-lasting impacts. So, of course, prevention of those infections is a key treatment approach or management approach. But then once we're managing the acute phase, we need to really then look at how is that impacting the gut? How is that mucosal integrity, either dissolved, or how can we fortify things? And that fortification helps us manage this autoimmune related inflammation. So obviously the triggers for inflammation can be infection, it can be trauma, but the neuroimmune pathways can also guide inflammation. And this is where there's the adaptive immune system is actually dysregulating, and it leads to that inflammation. So you can see here that different cell lines of our adaptive response can be either classified as pro-inflammatory or anti-inflammatory. And we see this, T regulatory cells. Obviously, there's a regulatory component, so there are those stop measures in place. So a decrease in T regulatory cells tends to propagate autoimmune inflammation, and that the pathogenic Th1 and very importantly, this Th17 cells contribute to autoimmune inflammation, whereas the T regulatory and T1 again are important for that immune tolerance and resolution of inflammation. So this is going to be important when we're talking about what are therapeutic targets. So when we have kind of something called adoptive transfer of the Th1s, if there's specificity for self-antigen, again, all our cells are tagged with the antigen. It's just when we're developing with thymus gland function, where a lot of T cells are being produced, there's this understanding of what is self, and let's not tag that. In this phase, there can be an adoptive transfer where the Th1 cells just they apply their specificity to self cells. And that then expands to all of these autoimmune conditions. So everything in life, don't we always hear this all the time, is about balance. So there is a tremendous importance on ensuring that you have a balance of these effector cells, because you still want to maintain that flexibility to be able to respond to acute encounters. So if we think about how we approach this, you can see this current opinion of immunology has a really great outline of the metabolic impact of Th1 cell function. So it talks about how the biological outcome of inflammation or autoimmunity and tolerance is often dictated by, again, these pro-inflammatory subsets of Th cells. So when we're trying to differentiate with Th helper cell differentiation, we need to approach from the gut microbiome, from any metabolic mechanism. So we know that in the liver, it has its own kind of complex immune network, and that needs to be engaged. And then, of course, metabolism, the gut health, and then that will engage and increase the actual tolerance. Okay, so that is what tips the balance. And we often talk about probiotics as shifting towards one side and how we can use that to influence. And ultimately what that is talking about is shifting this balance so that you're not over engaging in one side and actually uplifting the other. Okay, this is particularly important because we see in things like COPD has that autoimmune component, which is we are seeing that downregulation, and then similarly multiple sclerosis, you're seeing this tissue, the central nervous system demyelination, which is actually coming from a conversion of these T regulatory specific cells. They're being inactivated, and that's what's actually causing the demyelination. So T regulatory cells become incredibly important. So how do we start assessing for this? How are we recognizing this in clinic? Oftentimes, diagnosis is very slow for a lot of autoimmune conditions, and we want to make sure that we're catching things early so that the immune cascade or the inflammatory cascade hasn't gotten to a point of no return. So in BC, and I believe with Life Labs in Ontario, you guys can correct me if I'm wrong, but they have autoimmune assessments for NDs to run as part of our specialized panels. And in it, they have a number of markers that have been associated with autoimmune conditions. So, there's the RA, rheumatoid factor, which we know is particularly important for a number of arthritic conditions and autoimmune conditions to joint spaces, transglutaminase, which for gut intestinal regularity, for celiac, we're just wanting to ensure that there is no autoimmune component, autoimmune thyroiditis, so we have the TPO antibody, an antithyroglobulin, and an ANA, which also has reflex testing. So this is important because it gives us kind of the broad categories of where we tend to see a lot of autoimmune conditions. That being said, this is not complete by any measure. I think any practitioner would also want to ensure that they're adding on specific blood markers depending on the other conditions. But from a general perspective, we also really want to make sure we're understanding vitamin D function and baseline levels of vitamin D. And then assess for inflammation, which our best options would be CRP and ESR. These often get underutilized, and the pattern for CRP detection in autoimmune conditions tends to be elevated. However, it's in many autoimmune conditions, but not all. Interestingly, in SLE, the CRP is not chronically elevated. So that's why sometimes it can be swept under the rug and missed. But it's important that some of these characteristics and some of these aspects are examined early on. We know that CRP itself is important for activating the classical complement cascade, important in that immune inflammation function. It enhances phagocytosis and increases cytokine production. So very important key effector molecule, but doesn't have the same pattern in every autoimmune condition. So depending on what the autoimmune condition, I mean, again, most autoimmune conditions will have an elevated CRP, but you have these outliers like SLE. So you do have to be mindful of that and put into context. That's where it also becomes helpful to look at your ESR. I also just want to go back here and mention quickly that our anti-CCP blood test is one of the most specific for RA, so that would also be one that you could add on to an autoimmune assessment, particularly if there's any joint dysfunction and you're looking at something like RA. Now, what is the generalized treatment approach? Oh my, there you go. What is the generalized treatment approach? So we always want to fortify mucosal membranes and the integrity of the microbiome. So any place where we could start to get infection or something that distracts the immune system, right? Or some sort of actual threat that the immune system is focusing on, but then starts to, you know, that distraction, it then overcorrects and starts going to everything. So if you're trying to quench the autoimmune side of things, so to calm it down from attacking self, you still need to take away any external threat, so any appropriate threat. So that requires that you restore the integrity of your gastrointestinal system. Any of the liver detoxification capacity is going to help because, again, if you have high endotoxin loads, then the immune system is focusing on managing that and at the same time destroying self because it still has to be retrained. And then, of course, we want the nervous system and sympathetic tone to start affecting immunity. We know there's this huge impact with affecting immunity and inflammation. It needs to then be retrained. Again, it's the how to train your dragon situation. We need to retrain everything. So sometimes it's important to go back to the start and clean everything out. We'll talk about in a second managing that infection, but there needs to be an expectation that you're addressing multiple systems at once. And lifestyle is, you know, obviously such a huge part of that, you know, whole foods diet. We know that sugar is affecting innate immunity and it impairs that initial chemotaxis, phagocytosis. It creates reactive oxygenated species and prevents us from combating any actual infection. We also know that a deficiency in particular nutrients for the immune system is also likely going to tip the scales as well. And then understanding what root cause of chronic inflammation is present that is causing the immune function to support that T1, T17 response. We also want to enhance the innate immunity and NK cell activity, and we can do that with some cool tools there. So balance, again, what does a balanced immune function look like? It's where we're increasing that innate immunity, shifting the T helper subsets to the T regulatory and tier 1, and away from that Th1 and Th17, blocking those interleukins that are pro-inflammatory, like IL-12, and then increasing that checkpoint. And again, you don't want to increase too much, but you want to increase in a modulated way the NK cells. So overall, immune stimulation is never a good idea in autoimmune components, but we can start looking at immune modulation, and these are a few of those modulatory parts. So we're going to talk about 4, but know that this is not an exhaustive list. There's obviously way more. So zinc is often related in terms of one of the most essential micronutrients for regulating inflammation, wound healing, and as part of your immune function. But really, zinc needs to, like everything else, zinc excess and deficiency can both cause some pretty significant immune dysregulation. We know that in excess, zinc overload, zinc can overload the T regulatory cells and activation of macrophages, so this can exacerbate autoimmune conditions. And then zinc deficiency, meanwhile, again, we're getting thymus atrophy, so you're not able to actually produce those naive T cells and have appropriate responses. you have less of the T regulatory cells, and you're actually shifting more towards those Th17 production. So very, very pro-inflammatory. Now I know we've been taught that simple clinical test for zinc deficiency, which is, can you taste the zinc? Can you not taste the zinc? Keep in mind that, not tasting it is usually a sign, but you do also want to get those specific serum tests done, because again, you can get if you overcorrect, you can get this excess, and you're undoing some of the good work you did, because zinc is important for the overall immune function, and the homeostasis is pretty important for it. Okay, so similarly to zinc, we also want to modulate and ensure that we have proper vitamin D function for immune regulation, because it's a very important immune regulator. It's considered a steroid nuclear regulator, which has both innate and adaptive immune regulatory function. We know that individuals with IBD, strong autoimmune component to that, have a 2.28-fold increase in vitamin D deficiency. Now, is this a function of the disease progression itself, or does it actually enhance disease progression? That's less clear. But what we do know is that vitamin D3 itself does inhibit that T cell proliferation, particularly of those pathways that are pro-inflammatory. And we know that it's a regulator of, with the T cell development, it helps with differentiation factors, and that's particularly important because the more IL-12 production you have, the more you're inducing that autoimmune inflammation cascade. So vitamin D should always be part of your testing cascade, and then it may need to be regularly checked, because again, like anything, you have risk of toxicity, but usually fairly large doses are well tolerated. Colostrum, when speaking to early in immune cell development and immune competency, we're considering a lot of those cues are from that first milk, which is so rich in the antibodies. It also helps with our IgA. We're getting that from mother's milk, and then that can help with that gut mucosal integrity, which is why we often highlight that importance of breastfeeding for at least any period of time that is reasonable for the mother. But the benefit is within breast milk is that it has this component called colostrum, and that helps modulate that immune system and stimulating stem cell activity. So it's really important in terms of helping with immunoglobulin. It also has lactoferrin. It induces lactoferrin, which is going to help us appropriately manage bacteria and viruses and foreign objects. But what's interesting is it doesn't seem to have that adverse impact where you're overcorrecting. So it's helping engage the differentiation between self and non-self, while still addressing the threat. So another area that we talk about and is gaining more and more notoriety is the endocannabinoid system, and this is actually probably a misnomer. It's more an endocannabinoid biome. So it's much more dynamic. It's much more in flux. So you will get growth and dynamic changes and activation of much more cell receptors than what we used to think of, which is there's just CB1 receptors and CB2. But the ECS, until we get a better word, that's what I'm using. The ECS is this non-specific systemic response. And I always liken this to, it works in conjunction with our neuroendocrine function and with our immune function, and it acts kind of as setting up a perimeter. So it pauses everything, and will help the immune system with preventing over mast cell activation, so really good for allergies, but it'll also manage those inflammatory cytokines because it puts a pause and sets a perimeter. Like when you're triaging any sort of accident, you always want to set up a perimeter so nothing else is coming in and exacerbating or making a car crash area worse. You set up your perimeter. Endocannabinoid system is kind of like setting up that perimeter, and it then also has benefits for activating these anti-inflammatory mediators. So it allows kind of anti-inflammatory mediators to come in. And it's being studied quite a lot on a number of these anti-inflammatory pathways, and particularly with neuroinflammation, so cognitive disorders like dementia, Alzheimer's, and they're seeing some pretty promising aspects to it. So I think when we're looking at autoimmune conditions, and you need a specific, non-specific, widespread systemic kind of quencher or calmer, PEA is an important molecule because it's part of your endocannabinoid system. It's a phytocannabinoid, and it can help reduce those inflammatory processes. It activates, it's got lots of unique cellular receptors, and from an allergy perspective, it helps manage and stabilize mast cells. But it is this interesting molecule that's similar to CBD but different in that it is endogenously produced, and its structure facilitates, you know, a number of uses, and it's been studied in the past with as a non-specific immune modulator, activating CB2 receptors, which are found on immune cells. And when they were first studying it, they were looking in children and looking at its opportunity almost as an alternative to those who weren't able to access vaccinations in the 70s in the Soviet Union. They were looking at, okay, what else can we do to help potentiate and support in colds and flus to reduce symptoms? And so they were using it pretty successfully because they were finding that it was supporting immune function, the immune responses, but still quenching excess inflammation. So this is why the endocannabinoid system is not something that we want to turn away from, and more research is coming out about it. We have a number of magazines that have been published about this, but I know that we're kind of limited with time. So I just wanted to introduce the idea to you. There's certainly a lot of resources that we can send out to expand on this. But I think one of the most important opportunities for you when you're addressing autoimmune dysfunction is how you can start redirecting the inflammation, one, to quench it, understand that you're shifting away from those Th1 responses, engage in a complete assessment. So just running your RA or ANA is not going to quite cut it. You also want to be doing those additional tests of CRP as well as vitamin D testing, and then consider some more systemic mediators. So once you've gotten your zinc and your vitamin D and your nutrient levels sufficient, how do we calm and quench the entire system while still addressing any lingering threats and and calming the actual chronic low-grade inflammation. And that can be something that the endocannabinoid system is able to do. So thank you so much. I know you still have some time left in your lunch break. If anyone has any questions, you can pop them into the question bar of on the right side of your screen. And you can also email marketing or ask Dasha, and we can send you along some additional information. So I'll just need a second for any questions. Okay, everyone, thank you again for your time. I hope you're all well and safe, and we will talk to you again.